We have two sacroiliac joint fusions today. Both of these patients have very long spinal fusions. This patient here, you can't see it, this is our 3D spin after surgery, has like an L2 to the sacrum fusion, and then about a month ago had a left sacroiliac joint fusion right here. We just completed the right side. So one of the problems with doing particular long spinal fusion is that you'll see years later, and it's usually quite a few years later, they'll go on to sacroiliac joint pain and instability. So it's adjacent segment disease, as we call it. So these are our implants. They're well seated in bone here, right across the sacroiliac joint, done minimally invasive, incisions probably a hair over an inch long. See, so here are actually the sacroforamen. So we want to make sure that we're not near any nerve roots. And we do all this with the electrophysiologist, and we check and make sure that we're not near a nerve root. See, we're completely in bone. They look right. That was the right side, and this is the left side that was done a few weeks ago. And this other little thing right here is the post that we put in for navigation. So this post will come out. So this is the completion of our second sacroiliac joint fusion. This is our navigation post. Here you can see over here is at a spinal fusion, and these are our new implants right in here on the left side. You can see the implants on the right side here. Once again, this is what happens long-term in some of these patients that have these extensive spinal fusions. They talk about the disc next to it, so actually the joint next to it. So the adjacent joint distally or towards the feet would be the sacroiliac joints. And so this is where this patient and the previous patient suffered severe pain. So now both of them have bilateral sacroiliac joint fusions. This one was just done on the left, the previous patient on the right. From their first operations, which were about a month ago, they noted significant improvement, so I can only expect they'll find significant improvement from these fusions.